A new trend that's happening in the Medicare market and moving in big ways, I must say, are people who are on your Medicare supplement plans switching over to a Medicare Advantage plan. Traditionally, when you ran into somebody who was with the Medicare supplement and maybe they weren't your client, there really wasn't that much opportunity of a sale in terms of a Medicare policy. Typically, your Medicare supplements are set it and forget it type policies, aside from looking to see if there's any more competitive rate out there that somebody could switch over to if they were able to pass underwriting. We are starting to see a total shift in the market, and there's a few factors into it. One of the biggest reasons people are leaving their Medicare supplements is going to be because of the rising Part D costs that we are seeing in 2024 and are expected to increase even more in 2025. Traditionally, the PDP was always a big part of the budgeting for a Medicare supplement consumer. However, now that those costs are going to be coming more and more as we go on, people are starting to see that maybe a Medicare Advantage option could be more cost conscious for them. So the point of it is, as these rates rise, people are starting to see how much they're paying in total premium a year for coverage compared to a Medicare Advantage plan. And they're starting to see that even if I have some health issues, there's going to be some scenarios where a maximum out of pocket on a Medicare Advantage plan is going to be less than the total premium I would pay each year. And that's making a lot of consumers not only look over what they're getting for their A and B benefits for the cost, which of course, Medicare Supplements, Plan G, Plan F, Plan N, great coverage. However, it comes with a price. So as people are seeing Medicare Advantage plans become a lot more robust, a lot more competitive, and a lot more of that strong coverage, if you will, they're starting to see that they can get a lot more value for a lot less than their Medicare supplements. And of course, if people join a Medicare supplement when they turn 65, they have their 12-month Medicare Advantage trial rate period as well. So we are seeing people all over the country start to take advantage of that trial rate period. Take a test ride on the Medicare Advantage, see if it's a good fit for them. And during the meantime, they're going to save hundreds of dollars a month on a premium by going into a plan that can cost them literally $0 and provide them the dental, the vision, the hearing, the OTC, the flex, all those bells and whistles that we see Medicare Advantage plans tout today. So right now, if you have a book of Medicare supplement consumers that have been on the plan a while, it's most likely that they're going to be paying a rate that nobody's happy with. If they're healthy, if they're willing, and if they want to try it, they very well could be looking at a Medicare Advantage plan that not only can give them all the bells and whistles that they want, while also saving them upwards of thousands of dollars a year on premium. And here's an example of that. Your typical Medicare supplement consumer could be starting out, let's say, on a rate of $120. Maybe it's a turning 65 male, Plan G, and they have a competitive rate of around $120. Now, you also have to package on a PDP in there. Your PDPs can typically range anywhere from, we've seen $0 PDPs right now in the market, all the way up to roughly $80 to $100, depending on the market that you're in. So PDPs can be a wide range of cost. However, it really depends on how many drugs or what kind of drugs the consumers need to have covered by that PDP, which will typically be the reason as to why they go to a higher premium PDP. Nonetheless, as of right now, let's just say that the typical consumer's on a $15 PDP. So you have a $120 Medicare supplement to start and a $15 PDP, and that equates to $135 a month on top of their Part B. Now, Medicare supplements also do not cover dental, vision, hearing, flex cards, OTC, gas, utilities, all this stuff that these new Medicare Advantage benefits are really starting to cover beyond your A and B benefits. Let's add on another $25 for your dental, vision, hearing. Maybe it's going to be more than that as well, but let's be super conservative and just say $25 a month. Now we're at $160 a month, again, on top of the Part B cost. So these consumers are paying easily over $320 a month for their coverage. And of course, as we know, Medicare supplement rates are not locked in. Every year, you're probably going to see a rate increase, whether you're on a community rated plan, an age attained plan, whatever it may be. your Medicare supplement is going to get more expensive over time. And now we're also seeing that PDPs are expected to get more expensive over time as well. So where that consumer may have been paying $135 for their Medicare supplement in Plan G, over time, we know that that can get up into the 200s, 250s. It all depends on how the plan works and what carrier you're currently with, and that will help determine what the rate is. So talk to your Medicare supplement consumers. Just give a call while you're doing your PDP reviews and everything such as that. See if they're interested in changing and trying out a Medicare Advantage plan. They have a 12-month trial rate period, and if they ever want to within that 12 months, they go right back into the same plan. So if you want to learn more on how to be able to position this opportunity and the rising cost to your current Medicare supplement consumers, give us a call. We'll be happy to help. And we'll also do everything we can to help make sure that this AEP and then moving forward throughout the rest of the year is your most successful yet.